access. We opened 2 sites. We have a site here at the main campus and a site at our north campus. Those sites are operating. They're both operating. We continue to take appointments, but those sites are also fully scheduled through the end of our intention. Once we as we add more, we will add more appointments getting into February, so the public will be able to access those through the ways that I described in the statement.
How many vaccines have you guys already given out to first responders?
That's a great question. It's always dangerous to answer that in a general way, but I would tell you that we are in the neighborhood of 3,000 vaccinations that are that way. That would include first vaccines and then also supply for second vaccines. We're actually into that now in some of our sites, giving second shots. Folks that were in that first group 1A, we're working through that now. So that's a portion, a fairly significant portion of our shots right now.
And from now until the end of January, how many vaccines are you guys looking to give out?
It's a good question. It's a difficult question to answer. I can tell you what we have scheduled is at capacity for the sites that we have. That has been made in account with the amount of supply that we're getting. The state and DHEC have told us that we should expect a reduction in our allocation as they've added more sites. I think they've added approximately 60 sites across the state. So they're going to take the pool of vaccine. They've indicated to us that the state will not get additional supply with adding these sites. It will be expanded across the sites. So we're not certain what we're getting. Now, we also are aware, just as you are, the general public, that the federal government has said, I think it started with President-elect Biden saying he's going to push federal supply out. President Trump now has said that he's going to accelerate that. So that could, in fact, give us more supply, and if we have that, we will certainly take that into the opening slots that we have.
So if someone were to log on, because we're getting a lot of emails, I'm sure everyone is, just about, I can't find an appointment, I can't log in, I can't figure out what's going on, it's frustrating, or whatever else. If someone were to log into my chart right now, they would not have an option to do anything because you guys are taking more appointments, right?
That's correct. Soon, and I can't tell you what soon is, but soon we will be adding additional schedule going into February, and we will be reaching out. Folks will be able to get that information through my chart, just as what we did with the announcement around folks that are 70 years old and above that came out this week. We actually have more than 10,000 folks in our service area, our community, that have active MyCharts accounts with AnMed Health today, and that's growing dramatically every hour right now. We reached out and pinged those folks so they would be aware. We'll do the same thing so that they will be aware of those new sites and can begin to, those new scheduling opportunities, I should say, and schedule their appointments.
How quickly, if you happen to know, these appointments, how quickly did they go? Because it seems like it's like when you're buying a brand new shoe or a brand new product, and it's just like that, and you got to wait till the next shipment comes in. You know how quickly these appointments left my chart?
In general terms, I would say they went very quickly. It was the amount of hours, how fast that they went. And I know there might be some concern, well, if you were aware of this demand, why would you not have had more? I would say we just became aware of this very shortly before this time, so we're trying to dynamically react, and also, and I say that we became aware when you became aware and the governor made the statement, and that's great to expand it, but we're having to take into account all the challenges that we have, including being at our peak with COVID patients that are ill and need our care to be able to do this. But this actually is bringing to bear all of the vaccine we have right now, so that we're fully out with it, and we will grow that just as soon as we can.
You kind of touched on this earlier. Do you know how many appointments you currently have scheduled through the end of January? You mentioned how many you want to give out, but how many appointments do you have?
We could get that number to you. I don't know it exactly. I don't, but it would be the combination of our 2 legacy sites, if you will, at our north campus and at our main campus here, plus this coming Saturday, event for the 70 and older. We could get you that number, and Liz can work with you with that.
Thank you.
And you also kind of chatted about the Civic Center.
Yes.
Can you walk us back through that a little bit, just a little bit more detail?
Yes, on this Saturday, we will be operating a vaccine clinic. We expect to give 500 vaccinations that day. That schedule is fully full right now. Folks have registered through my chart. That will be our first foray at that site. It is a site that this is our first run there. We appreciate, again, working with the county for this. It is a site that will be scalable, and we expect that we will scale that larger going forward, but we're not prepared today to go beyond Saturday. But soon that will be coming, and we'll use that site. I want to encourage, again, if I could, that we are not prepared, and would ask that folks don't attempt to walk up to that site because we are fully scheduled, and that means we literally will not have a vaccine for you, and we wouldn't want to frustrate people or, again, erode folks' safety with that.
And it's also because of the safety.
Yes.
Safety.
Yeah, we're doing everything there. The site is a very good site for us. We want to be accessible. It's a good accessible site. We also want to have adequate space for folks to be appropriately distanced from one another. And the process of vaccination, there is a period of time that it takes for registration and to get folks into the VAMS, the vaccine monitoring system. Also, once the persons get their injection, they have to be held and monitored for 15 minutes just to be sure they don't have any reaction and it's safe. So it takes time as you bring up scale to be able to have space to safely do that. I hope the public can appreciate that. I know sometimes folks compare this with flu shots. This is considerably more complex than flu shots.
Anything else that you could say to people out there who are still wanting to get it but can't get it, about being patient during this time?
Well, I appreciate very much that they are wanting to get it. That is extremely important. We want to do everything we possibly can. I know our partners do to allow them to get that vaccination just as soon as they can. And I just hope that they will trust us that we are doing that. I'm not I perhaps shouldn't speak for across the state, but I really believe I know that everyone from the state, from DHEP, from every hospital in the state, we all want that same thing, but there are limitations into what we can do, and we're going to move just as quickly as we possibly can, and we will meet your need. Thank you for your patience. Thank you for your understanding. Thank you for your vigor to want to get this shot. We're all excited, and I'm pleased the public is excited. We're doing something to kick this virus to the curb. Let's get it done. Thank you, guys.